I had those two tools that I wanted to go over with you. First is called a TENS unit, and the next is called sterile water injections. And you can ask if your provider offers these, because some don't. I don't know why, because this is the bomb. It's so awesome. With sterile water injections, a provider will take some sterile water and they'll inject it into 4 points around your sacrum, just into the skin. And it can feel like a little sting and burn, you know, in 4 points, which is pretty uncomfortable. But then after that, it is supposed to significantly reduce back pain for up to 4 hours. And I've seen this prevent epidurals. It's really incredible for people who are like, I'm just having so much back pain and I can't handle it anymore. And then we do the sterile water injections and they just have like relief in their back. And they're feeling more of the sensations in their belly, which is usually a lot easier to tolerate for long periods of time. And the back can feel really uncomfortable sometimes, and it can be hard to do that for a while. So that is one tool to be aware of. And then the next one is a TENS unit, and I have one. These are really cool. There's 2 different ways that it works. There's the gate control theory, and then there's this, I forgot what it's called, but basically it means that it tricks your brain into thinking you're in more pain than you are. So it will get your brain to release more endorphins, which is cool. So if you put it on the high setting, that's one way that it can work. If you put it on the low setting, it basically does this thing where it makes your brain be like, can I handle this stimulation and interpret the stimulation and also the stimulation of the contractions? I'm just gonna pick one, you know, and it can in that way make your pain a little bit reduced, which is kind of interesting. But this is an evidence-based tool that can help with pain management in labor. And you might not feel any sensations in your back, but if you do, just know that those are 2 tools that are really helpful. And the other tools would be that counter pressure and that double hip squeeze on each side where your hands are pointing together. Those tools are really, really helpful for back relief.